Hi everyone. Today I will be presenting a clinical case of a 25 years old female patient classified as high caries risk, and I work together with the dental student, D3 student Jonathan. Um, this assessment it was based on multiple disease indicators, risk factors, and clinical findings. Radiographic evidence show new and progressing caries lesions into dentin, along with proximal enamel lesions. Clinically, the patient presented with deep pits and fissure, visible plaque accumulation, and fractured crown, like you can see here, all of which increase plaque retentions and caries susceptibility. So to evaluate caries risk, I use a combination of radiograph, clinical examinations, and salivary testing. The patient's ATP reading showed a height reading of 5,589, indicating a significantly elevated acetogenic bacterial load. Also, the saliva assessment showed watery consistency, suggesting promised protective function, although flow rate was within a normal stimulated range. Um, the patient also demonstrated several behavioral and environmental risk factors, including heavy plaque presence and high bacterial activity. While protective factors were present, such as fluoride toothpaste use and living in a fluoridated community, they were not sufficient to offset the high disease activity. Based on these findings, the treatment plan included 8 restorations, 2 crowns, and scaling and root planning, limited in all of the 4 quadrants. In addition to the restorative care, patient's education was a key component. I emphasize improved oral hygiene practices, plaque control, and consistent fluoride toothpaste use to help reduce bacterial load and prevent further progressions. To reduce the patient's caries risk, I implemented preventative strategies including reinforcing oral hygiene instructions, recommending fluoride-based products, and closely monitoring caries activity. I also discussed this case with the DST3 student, and he provided helpful recommendations, including emphasizing the use of high fluoride toothpaste and fluoride varnish applications, as well as closely monitoring high risk area for early intervention. He also reinforced the importance of combining both restorative treatment and preventing strategies to effectively manage the patient conditions. From this case, I learned the importance of combining objective data such as library diagnostics with clinical and radiographic findings to make comprehensive risk factors in assessment. It also highlighted how multiple moderate risk factors can collectively place a patient into high risk category. In conclusion, this case demonstrates how thorough assessment and individualized care planning are essential in managing patients with high caries risk and improving long-term oral health outcome. Thank you.